Let's focus now on healthcare and talk about those rising deductibles, and I mean deductibles. Our next guest wrote about it in Forbes. Joining us now is healthcare policy watcher John Goodman. John, welcome to you. Look, some of these deductibles are in the thousands, which begs the question, why bother? What's the solution? If I have a $4,000 deductible, in other words, I have to spend $4,000 before I get anything back.
Well, to a lot of people, that's not insurance at all.
It's not.
So many people live paycheck to paycheck.
Right.
And $4,000 is the average deductible for a silver plan in the exchange. But there are some employers who, especially of fast food workers, who really don't want their workers to sign up for insurance. They're required to offer it to them.
And they don't want them to.
No, those deductibles could be $7,000 for the individual or more, and double that if they have a family.
That's outrageous. You know, even if they are low, I still believe that in this country, even if you have to pony up $500, that's a lot for many Americans, as you say, working paycheck to paycheck. They don't have $500 lying around. So it doesn't take thousands to put people in trouble.
That's right. Now, I'm the sometimes called the father of health savings accounts.
Yes.
And that's the way I think we should go, to have savings on the side. Let us manage more of our own money. We're much better when we're managing our own money. We're better than the insurance companies.
So in other words, put that money aside so when you do need to go to the doctor, and God forbid the hospital, you have that money there to use.
Yes.
It sounds good in theory, but there are other studies that say Americans, especially all of those living paycheck to paycheck, don't have any money to take care of any emergency. So why do you think it's possible that they can actually put this money aside for healthcare?
Well, they may not. Now, in the old days, we found that if you moved to a higher deductible, it made economic sense. You could go from $100 to $1,000, so you have $900 more risk.
Right.
And we save more than $900 on premiums. So everybody who's listening today ought to look at the choices and compare the additional risk with the amount of savings. But we have created perverse incentives for insurers and employers, and their incentives are to avoid sick people. Healthy people tend to buy on price, which means premiums. Sick people look at networks and deductibles.
Right.
The typical insurance company today does not want a sick person.
Do we get this thing? Look, the Republicans came into power and said, this is it. We're going to throw Obamacare out. We're going to put a great new system in place. It hasn't happened. Are you hopeful that a system can be finally figured out that will work for everyone?
Republicans have to do two things. One, they have to decide that all the money in Obamacare stays in health care. We can't use it to cut taxes for the rich.
Right.
I think they've all come on board on that. But number two, they have to show us how the reform plan is going to lower premiums and give you better access to doctors. And they haven't come on board with that yet.
It's not easy. That's the problem.
That's right.
All right, John Goodman, thank you so much.
Thank you.
Appreciate it. Thank you.